The theme of this presentation is that your body is a miraculous self-healing machine, and that heart attacks, strokes, dementia, and most cancers, most common cancers, like breast cancer, colon cancer, prostate cancer, are completely avoidable. They're not the inevitable consequence of aging. They're not predominantly genetic. These diseases never occurred in human history. We're eating ourselves into a premature grave, but it's not that we're dying prematurely. It's that there's so much needless suffering and fear and tragedy and poor quality of life, and people living in nursing homes and having needless medical care and painful medical interventions. And in other words, we could achieve so much a better, happier, and more, and more fruitful, productive life if we take care of our health now when we're young. It's better than putting money in your bank account, because money is great to have a lot of money when you're older, but what good is your money if you don't have your health? Your health is your greatest wealth. That affords you the ability to have a happy, long life and to enjoy your golden years. For most Americans, the years between 65 and 70 and 85, if they were to live that long, are poor quality. And most people above the age of 80 have a very poor, healthy life expectancy, meaning their quality of their life is very poor. So this is all about hope. This is all about you being able to control your health destiny. This is about you being able to live your life free of fear and in control of your health, because modern advances in nutritional science has enabled us to disease-proof our body to a large degree. And that's what this is about. So even though we're talking about breast cancer today, what you're learning today is going to protect you against heart disease and dementia and strokes as well. It's not just about breast cancer, because the same excellent nutrition that protects you against cancer obliterates your possibility of having a heart attack or a stroke. So it's just crazy not to do everything together. Okay, before I start, there's one thing I want to say. That I'm trying as much as possible to give you information from the scientific literature and to make it understandable. And I'm trying as much as possible not to present opinion, not to give you my personal feelings, emotions, or opinions. You can use your own opinion to judge what you want to do with this material. I'm trying to deal with facts and being as impartial as possible. But I realize that people's thinking and their judgment and their decisions are based on much more than just fact. They're based on what you were socialized to believe your whole life, your belief systems, what everybody else believes. You want to think the same way as they think. And what you've learned in life up to this point, there's so much incorrect information that what you're thinking right now is not right. So I need to change the way you think. And I want you to change the way you think without you being angry at me personally for presenting information to you that you may not like. If you're angry at this or have tremendous disagreements with what I'm saying, then you're going to have to look at the medical studies and the scientific evidence and see if that evidence holds water, right? So don't blame the messenger if you don't like the results of the studies. The other thing is that some studies have more credence than other studies. Some studies we have to give more credence to because they're longer-term studies. They go on for 20 or 30 years. Studies that go on a year or two aren't as important. And also, studies that have hard endpoints, like death, are more credible than studies that show weight loss or cholesterol lowering or some other factor that can occur in 6 months or a year. You following that? We put more weight on studies that earn more respect because they go on for more years, they have larger numbers of people, and they have hard endpoints like heart attack, breast cancer deaths, or overall mortality or death rate. Did you follow that? So lastly, I'm asking you to suspend what you learned. Try as hard as you can to suspend what you learned when you grew up. Suspend what you learned in graduate school. Suspend what you learned at that nutritional course you just graduated from. Suspend what you learned in medical school. And let's see if we could, as scientists, use our intelligence to review the information with a logical mind, without input from what you think you know or you want to believe. Okay? Sound fair? All right, let's get started. Number one, cancer afflicts a lot of Americans, right? A lot of people get cancer in this country. It's not the leading cause of death. The leading cause of death for adults is heart attacks and strokes. And as you can see, breast cancer is not as big as lung cancer, but breast cancer is still the #1 cause of death in women outside of heart attacks and strokes. But most men with prostate cancer don't die of prostate cancer. Most men with prostate cancer die of heart attacks. Did you follow that? And if people didn't smoke, obviously we'd lose probably more than half the cancers in America just if everybody stopped smoking cigarettes. So when I say cancers, when we can win the war on cancer, it's not some pie-in-the-sky radical statement that we can win the war on cancer. Because more than half of cancers would just disappear practically if people stopped smoking cigarettes, right? And look at countries around the world that have 50 times less cancer than we have in this country. How could it be? Is it so radical to say we'll win the war on cancer? We can't do as well as they do in Gambia or Cambodia with regard to breast cancer? You following me? So these are year 2000 statistics. Cancer rates in Gambia and Cambodia and Thailand have gone up because we've exported American way of life, American fast food restaurants, American style of eating has been exporting our lifestyles across the world. And I'm going to show you as that happens and as people change their eating style to adopt more American ways, their cancer rate skyrocket accordingly. Breast cancer is about 25% of all cancers in women, even though it's the leading, it's the leading cause of cancer. And as you can see, the 10-year survival from breast cancer, whether treated or untreated, whether left alone or whether you're doing treatment, is still over 80%, 10-year survival. Prostate cancer has over a 98% 10-year survival. And as I said before, most people with prostate cancer don't even die of prostate cancer. It's generally, in most cases, a relatively slowly growing cancer. And if people worried more about heart attacks, they'd save many more lives. But protecting yourself against heart disease and keeping your blood pressure and cholesterol low is so important for breast cancer protection. And why is that? Why is it so important to exercise, keep slim, and eat right and avoid salt to keep your blood pressure low and your cholesterol low? Why is that so important for fighting breast cancer? You're looking at me in some puzzled fashion. And the answer is because the drugs used to lower your blood pressure and lower cholesterol can increase your risk of breast cancer. That's why. Calcium channel blockers, for example, over 10 years of use are associated with doubling of risk of breast cancer in women. Statin drugs, over 10 years of use, studies show, double the risk of invasive breast cancer in women. What if you're using multiple medications? Calcium channel blockers, statins, antibiotics, other medications that all have risks associated with them, increasing risk of breast cancer. In other words, the more you take good care of your health nutritionally, the more you avoid the need for medical care, the more you avoid the need for going to physicians to get radiated, to be taking drugs and other interventions and antibiotic use that increase your risk of breast cancer. Following this? Here's the point, too, is that the amount of women dying of breast cancer is around 25 per 100,000 each year, and that hasn't changed significantly in 90 years. Let me say that one more time. Before we had mammograms, before we had chemotherapy and radiation, the same amount of people were dying of breast cancer. And over the years, medical interventions hasn't changed that. Women aren't living longer today, and people aren't having better outcomes today because of medical care. They're having around the same outcome as they had years ago. And studies from the Cochrane analysis, and I'm going to mention the Cochrane analysis the most, because when we're going to give this study more credence, we have to look at an independent body, like the Scandinavian Authority, that does meta-analysis. That means they put many studies together to get as much large amount of people as possible, and they're very impartial. Studies done in America are usually funded by the drug industry or medical industry or the radiologists or whatever. They're funded by medical, monetary, and economic interests, and they're not as credible. You have much more credible studies done internationally, and when they pool studies together, these scientists from the Cochrane group they put weight on studies based on their influence from economic, and they weigh studies based on, whether there's factors that would make the study less reliable and less trustworthy. So we have to look at the most trustworthy and the most credible studies to come to conclusions. So the first thing is that we're not living longer today than ever before. Matter of fact, people lived longer and at lower cancer rates years ago. Sure, we have overall a much increased lifespan, around 80 years old, because we have women no longer die during childbirth. Years ago, 1 in every 9 women died during birthing. And a lot of children died during the birthing process in infancy and early childhood due to infectious diseases. So because we had such a high infant mortality rate and such a high rate of women who died giving birth, it makes it seem like we're living longer. But if we look at studies on people who survived to middle age, people who lived to be 45 or 50 and they didn't die during birth, and men who didn't die during their childhood or didn't live in accidents, and we look at the studies on those people, then we find that people who lived in the 13th century, the 14th century, the 15th century, the 16th century lived longer than people live today. You follow that? So we have, for example, studies on the Renaissance artists who lived in the 14th century. And these are males who survived to produce works of art, and their overall lifespan was greater than the average American male today. Okay. Number two, besides the fact that we haven't really succeeded in wiping out breast cancer, we have to recognize that this is a new illness that never occurred in human history. Breast cancer didn't occur in ancient civilizations. When we have frozen bodies, preserved bodies, bones, looking at metastases or soft tissue tumors in corpses and in preserved bodies and look at mummified bodies, we find no breast cancers. No cancers, actually. There was only one case of cancer, rectal cancer, in 400 female mummies that were reviewed by scientists. We're talking here that breast cancer wasn't even mentioned in the scientific literature. With all the writings on medical problems through the 12th, 13th, 14th, 15th, 16th century, these cancers that we see today were never even mentioned. They weren't even seen. And don't forget, when you're not surgically removing tumors and radiating them and shrinking them with chemo, you're going to see large masses of cancers in bodies and in their deaths. And it should have been recognized cancer as a cause of death earlier in human history. The point is that these are modern diseases. It's a man-made disease. It's not found in natural living populations. It's not found in the natural world of primates or other animals or mammals. Unless we, of course, put them into captivity and we feed them American food, we don't see them developing cancer. It wasn't until about the 17th century where cancer was first noticed and mentioned in medical writings. And the first cancer they noted was scrotal cancer, noted in chimney sweeps in the late 1700s. And of course, nasal cancer in snuff users and Hodgkin's disease was first noted not until 1832. So even childhood cancers were virtually unknown in the history of medicine. So this idea that cancer is a genetic issue and we've inherited from our parents and there's nothing much we can do is totally ridiculous. You don't have to have cancers, and we're not going to wipe out all cancers in America because people are, number one, they're not going to adopt such a healthy life. And I'm not under some idea that people are going to radically change their diet to do how I want them to eat. But number two, they've done a lot of bad things the first 60 years of their life, and I'm not suggesting that after eating poorly for 60 years, changing your life can wipe out the risk of cancer by 100%. I'm not saying that. I am saying, though, you could reduce your risk by more than 90% and maybe close to 100%. I don't know the exact numbers of how much we could reduce our risk. But I'm going to present you some information that's going to allow you to allow you to observe how I come to that opinion and how much reduction we could get from cancer based on studies that have been done already, okay? On what kind of percentage reduction we could get in cancer. Now, cancer mortality has been growing worldwide in the last few hundred years, particularly after World War II in the 1940s when people started eating more processed foods. They started in World War II where they were designing concentrated energy bars and energy drinks and fake canned foods that they could take with them and eat on the battlefield, right? And they came home and people started eating more candy bars and concentrated calories and soda. Never was much in fast food restaurants, not much around the 1940s. And scientists didn't identify vitamins and minerals to put supplements into food to the 1940s and 1950s either. Right? Vitamins and minerals were not identified in the early parts of the 19th century. So we're talking here about that vitamins and minerals were first identified around 1940, 1945. You didn't start adding thiamine and riboflavin to Cocoa Puffs and vitamin C and folic acid to Kool-Aid. You didn't have these things back then. And not only did we start eating foods that didn't have the natural levels of nutrients in them, but we started using artificial nutrients made from petrochemicals that may be a factor in increasing risk of cancer. I'm going to talk about that as well today. The fact that certain supplemental ingredients like folic acid, like vitamin A, like beta-carotene, have a strong potential to increase a woman's risk of cancer. And women are popping these pills thinking they're beneficial, and we'll talk about that. But the cancer rates continue to climb worldwide. They continue to climb today predominantly because we're exporting American way of life, and countries that had more vegetation, more plants, and more natural foods in their diet are now eating more sugar, more oil, more meats, more processed foods. And we're seeing cancer rates still skyrocket. And there's a lag time between when you make your diet poorly to when cancer occurs. For example, the atomic bomb went off in mid-1940s in Hiroshima and Nagasaki to end World War II. And that population saw a 500% increased risk of colon cancer and a dramatic rise in breast cancer from the radiation exposure, which continued to climb. That peak of cancers continued to climb 30 years after exposure to that radiation. Did you follow that? If you're looking at any study, like if I'm going to say to you, which I will say this, that taking folic acid, which is not the same as folate you get in a real green vegetable or bean, folic acid is a different compound. And taking folic acid prenatally, or taking it in vitamin pills, is going to increase risk of cancer. And you're going to say, no, no, no. Here's a study that showed that it didn't increase risk of cancer. And I'm going to say, how many years did that study go for? If the study went 3 to 5, less than 10 years, disregard it completely. The study has to go at least 15, preferably more than 20 years, to see the effects. Did you follow that? Large number of people, going for many years, hard endpoints. You follow what I'm saying here? So, breast cancer is not natural. It's completely unnatural. It speaks to how unnatural our lifestyles are today and how unnatural our diet is today. And lung cancer is not natural. Cavemen didn't get lung cancer. They didn't smoke tobacco. But you know, we're not going to come up with this magic pill that's going to enable people to smoke 3 packs a day of cigarettes and then take this magic pill to wipe out the risk of lung cancer. It's not going to happen. Certainly not going to happen in our lifetimes. And you can't eat the American diet, and you can't expect to be an overweight American eating sugar, oil, white flour, fast food, and hamburgers, and bacon and cheese. You can't expect to eat the foods other Americans eat and not get breast cancer. And let me tell you, they're not going to come up with some magic pill that's going to enable you to eat all the junk you want to eat and not get breast cancer. It's not going to happen. If you're a typical SAD eater, SAD eater, it's sad, right? It's sad if you're going to, I call it the DAD, the deadly American diet. If you're going to eat the deadly American diet, you're going to get demented, you're going to lose memory, you're going to develop atherosclerosis, inevitably, you can't escape from it, and you're going to get cancer. And most people that die in America, whether they die of heart attacks or strokes or Parkinson's disease, most of them have cancer. Let me say that one more time. Whether they die of heart attack, whether they die of stroke, whether they die of Parkinson's, whatever they die of, most of them have cancer. It's just not the cause of death. Did you follow that? If you eat American food, you're going to get cancer. I'm going to quickly ask you a question, one question of this lecture. How many women you think in America over the age of 60 years old have breast cancer? Let me say this, breast cancer cells, not detectable on a mammogram, but have breast cancer cells in their tissues right now. 80% or more, 98%. Good guesses. Probably around 70 to 80% is a good guess. 80% might be a good guess. I'm going to talk about that. A lot of people in this room have cancer and they don't know it, but here's the thing, is that the earlier the cancer is, the more likely nutritional impact can cause it to regress and go back the other way. The more it advances, and the closer you are to death for any disease, the less chance nutrition will give you to get totally well again. That makes sense, doesn't it? So there's an advantage to starting, so whether you have cancer or not, whether your cancer is diagnosed or not, it doesn't matter that much, because now is the time to do the right thing. Not tomorrow, not after you're sicker or closer to death, but now. It's never too early, and whether it's too late or not, I can't judge that, because I have plenty of cases where we thought it's too late and people still reverse their condition. It may not reverse it with 100% predictability. It may not be the odds may not be as great in your favor as if you did it when you were younger, but doesn't mean you don't do all the right things no matter what stage you were at. Do you follow what I'm saying? I'm going to show you cases of advanced cancers later on today. People from Flemington, from this area of the country, who were my patients 15, 17, 20 years ago. One woman, she had metastatic ovarian cancer, went to her lung with 4 liters of fluid into her lung, given 6 months to live. And this is 19 years later, and she's in great health, alive today with no cancer. Right? So we didn't give up on her. Right? Another woman with metastatic breast cancer to her bones on bone scan that went away. The bone scan cleared. Not saying these are happening. I'm not claiming this has happened in predictable or every fashion, but I'm a family doctor in Flemington for more than 25 years. I don't see that many cancer patients all the time, but the cancer patients I have seen have done remarkably well. It's amazing. The percentage that have done well is amazing. That's why we're launching major studies with tens of thousands of women right now.